Deep River is a community of about 5,000 people located about 2 hours northwest of Ottawa. We are a multi-sector organization. We have an acute care hospital with 16 inpatient beds. We also have a long-term care home and a primary care family health team on site, all within the same organization. Part of that includes our diagnostic services, which are laboratory and X-ray and ultrasound. In the spring of 2021, we found ourselves suddenly without our in-house radiology support. And so at that time, we began to work with RTM to organize and implement teleradiology to ensure that we were able to continue to supply diagnostic imaging services to our community. When we began to investigate a remote radiology service, one of the considerations was their ability to integrate with our existing PACS system, which is Philips CareStream, and their ability to support our transition to the Epic EMR as part of the Atlas Alliance in November of 2022. So we spoke with another regional partner who had been using RTM for about 10 years and had already begun initial conversations with how RTM would be able to support their transition as they're joining us when we move to the Epic with the Atlas Alliance. So that was one of the considerations. Previous to implementation with RTM, our turnaround times for results would vary. During the day, we had relatively quick turnarounds, but in the evening or overnight, there would be a delay until the next day. With RTM, we have truly 24 hours a day, 7 days a week reading. So RTM does provide results and radiology services through the nights and on weekends. So our practitioners, our physicians and nurse practitioners who help support our community are able to get results very quickly. And RTM does provide a wonderful framework for turnaround times that they are able to meet, which helps improve our treatment times. Prior to having remote radiology services in place, if a patient was seen later in the evening or through the night, they would often have to return the next morning to receive the results of their X-rays. Now with the 24-hour services that are provided, we're able to provide the exam and the results in the same visit, which definitely saves our patients time and decreases the return visits to the emergency department to get results the next day. We have definitely had the instance where we have had a critically ill patient present to our emergency department after hours, and we are now able to get those results for any imaging that's done, whether it was a trauma or respiratory distress. We're able to get those results for our images. The turnaround time is in minutes and does not require any additional calls to be made to have those images read. The radiologists are there, ready and willing to read any time of the day.